As a chiropractor, when you hear the word trauma, it's natural to think car crash or sports injury. But there's another type of trauma a lot of your patients have experienced that may not be front of mind. It's the trauma resulting from personal abuse or neglect and includes a family history of substance abuse, mental health issues, and divorce. This type of trauma affects over 70% of the population, which means the majority of your patients. In addition to the psychological impact, trauma has physiological effects, including chronic inflammation, which, as you well know, leads to chronic disease and chronic pain. In fact, 84% of chronic pain sufferers have a history of trauma. As you connect the dots, a high rate of trauma, an even higher rate of chronic pain, you can see why chiropractors need to be sensitive to the special needs of those patients with a history of trauma. There's a growing model of care that healthcare providers of all types are embracing called trauma-informed approach, or TIA. And that's what we're going to talk about at the CCA Fall Conference at Disneyland. Simply put, trauma-informed providers, including trauma-informed chiropractors, take a special approach to patient care to reduce the chance of re-traumatization that is present when performing a history and examination, as well as treatments. Hi, I'm Dr. Chris Greene, and I will be teaching you about trauma-informed approach. You will walk away knowing how to connect with patients in a way that strengthens their trust in you, which means greater compliance and improved outcomes. Not to mention, the more you know about trauma-informed care helps to open the door of collaboration with healthcare providers in your community who are trauma-informed as well. I promise you this won't be a boring lecture. There'll be plenty of time for questions and answers, and maybe even a little role-playing as you learn how to be a trauma-informed chiropractor. I can hardly wait to see you there.